Hi everyone. I'm Dr. Hari. I'm an ophthalmologist. So what happens is that when we scroll on social media, we generally tend to get an advertisement which says, "Get your LASIK surgery done." So I was just curious and I just clicked one link, and believe you me, I got a call back instantly, and the conversation that I had with them is very interesting, and I think it's very prudent that put it out there in public domain so that everybody knows what goes on. To start with, you know, I'll just play the clip for you and keep stopping and explain what each and everything is there.
ICICI with ICICI in Vasan also it will be completely claimed, completely cashless. You don't need to pay for.
I couldn't record the conversation from starting, but however, this is a company based in Bangalore who is doing a lot of marketing for laser vision correction. They have tie up with hospitals across the country, it seems, and they had taken few names also. So understand that these names are taken by that company directly. It's a direct recording of the call. I have the number also with me. So.
Consultation. There will be consultation tests. Okay. So after the consultation test, there will be processing the insurance initial approval.
So now coming to the part where they touch upon the insurance part of it. Okay, as you all know, I'm slightly more inclined towards the insurance claim processing part. So let's explore what they're saying.
In the initial approval only, you'll be getting around 50% of the amount claimed.
Okay.
Okay. After that, you're getting 50%. Now 40 to 50 you'll be getting. So remaining amount in the final approval you'll get.
Okay.
So after you getting the 50%, then
So till here they are saying the correct thing. Okay, that initial approval, final approval.
only they will be starting with your surgery.
Okay.
Got it? And only medication charges need to be paid from your end. That could be around 4 to 5,000.
Okay.
Other than this 4
So they're directly saying that only the medication charges needs to be paid from my pocket, which will come to around 4 to 5,000.
to 5,000, nothing we need to pay. So everything will be done completely under cashless only.
So if that see, my question is that if my power is -4 and the limit is when the insurance is 5.5, then also it is possible.
Yeah, 100% it's possible.
So I categorically asked the lady on the phone that even if my spectacle prescription is less than the limits specified by the insurance company, then also whether it's covered. So the confidence by which the person on the other end said that it is covered is very alarming. Okay, it sounds a bit fishy. So I just try to get more in details.
Yours is like -6, right? And your age is also 27. So might be we can be processing with LASIK only. Why? Because in LASIK there are different types. So I'm just telling you, go for the consultation once. Then only like your corneal thickness we can justify.
Me, actually, I'll tell you, one eye of mine is -6, other eye is -4.
-4. Okay.
So one
Done.
is
Got
more
it.
than the limit, the other is less than the limit.
That won't be an issue. Why? Because in insurance, every insurance will be mentioning some -5 or some other -7 will be there. Cut off.
So here she categorically says that in the insurance there are different limits, but it doesn't matter. It doesn't matter whether what's your prescription. So let's hear more.
But what we do is we won't be taking any of the concern regarding this -4 or -6. The LASIK surgery will be, we can do the LASIK surgery up to 7 or 8
Okay.
power. Below 7 or 8, every person will be eligible for LASIK.
So here she categorically says that we are not going to pay heed to whatever your prescription is.
Just the thing is, in insurance claims won't be done through this powers.
Okay, that means
Okay.
I'll have to pay for it.
You need to pay for that. But no, from our end, right, you don't have to pay.
Okay. So
You usually the procedure will be like this, okay? For below -7 or -8, they won't be claiming the insurance amount. You can be undergoing the procedures. The same LASIK surgery only will be done for you. Okay, for getting you the claim amount, right, we will be directly asking the insurance team just for the medications.
So she says that the insurance claim will be only for the medication. So I was just wondering that the medication, few eye drops, protection glasses, how much will it come to? It's not much. So asking the questions further.
So,
Okay, not directly for the LASIK.
so you will not mention LASIK in the case sheet only.
No. We won't be mentioning the LASIK.
Okay.
So they're saying that they will not mention LASIK in the case sheet at all. And yes, now comes the interesting part.
The internal procedure, what you will be undergoing is 100% LASIK. But the thing we want to inform insurance people is not LASIK.
So what will you claim
Your
it as?
power will be directly claiming under the medications.
As
These are
medication, how can you claim that kind of an amount in
why?
medication?
Because using the serum. Serum name is Contora serum.
So she suddenly now deviates towards something called as Contura serum. Contura is a procedure. Okay, Contura is basically a topographer which takes the scan of the eye, and accordingly the laser ablation is done. Now she is saying that it's Contura serum. Now let's see what more new things I can learn about.
Okay, that will be costing around 40 to 45,000, and the anesthetic injection will be all these three things: anesthetic injection, serum, and the LASIK machine, which is called as femto. These three are the main things in
So the
LASIK
moment
surgery.
you,
According to the lady on the other end, there is something called Contura serum, anesthetic injection, and femto. So I am puzzled.
moment you mention femto or contura, because this is also techniques of LASIK, insurance company will say the power is less than the limit.
Not at all. Why? Because we won't be mentioning it as femto. Three ingredients we are using. Just think like that. C3R is the name of these particular medications we will be using. C3R. You can just check it over the
Okay,
Google
so
if you
basically
want.
you will be billing it as C3R.
So now comes the actual part. So the lady on the other end says that we'll be billing it as C3R. C3R is a corneal collagen cross-linking procedure which is done for keratoconus. That's not a refractive surgery. That's an actual treatment. That's a therapeutic condition. And the equipment used for C3R is very different. It's not the LASIK machine. It's basically a UV light source which is used with riboflavin. So here, what I can now make out is that this particular company is in collaboration with whichever hospitals is billing the LASIK cases as C3R cases and getting insurance claims passed through that.
C3R. Yes.
Okay.
So in that procedure, we will be completely raising the amount.
Oh, understood. So you will not mention LASIK, but you will mention it as C3R.
LASIK. That's what. Yes, you got it.
Okay, got it. So ma'am,
This is the internal thing. I request you not to just tell this thing if you are willing from our end. Okay?
okay. No, ma'am,
Yeah.
see, now Gagan Eye Care, what you said, is doing the surgery at Kesar, but that's very far.
So here, before I started the recording of the conversation, the lady had taken out few names of hospitals in Hyderabad and places of where they do the laser. So see, the thing is, I understand taking names may not be a good thing in everybody's interest, but I feel that since it has come out from their end, they have mentioned it as it goes. So it is very important to know that what happens in the real world.
For me, Gagan Eye Care.
Vasan, Secunderabad?
That's an option. But Vasan, I went there, I had a bad experience earlier.
Usually people won't be willing for Vasan.
Any
So
other
that's the
options?
reason I told you, Gagan. In Srinetralaya, which is in Kondapur, right? There also we can do that.
Kondapur also is very
Same
far,
surgery.
madam.
Okay, only these three are available for ICIC Lombard.
Ma'am, I have a Mediassist
So
insurance
I
card
just
also.
wanted to give a bait of Mediassist insurance because that's one of Mediassist TPA. That's one of the most largest TPAs. The coverage is more. So let's see.
Medi assist also same. Yes, less approvals they will be giving.
Okay. Nee, if I have Mediassist, which are the other options? Vasan you said, Gagan I said, Srinetralaya I said.
Same, these three only.
These three
Medi
only.
assist, ICIC Lombard, only these three can be processed.
Okay.
Yeah.
Got it.
I'll share you the details, okay, from my end. Just share me your insurance e-card once. I need to check with the TPA which you are holding on.
Will do, ma'am.
So I'll just confirm you. I'll share you the three hospital details as well. Just check it and let me know.
Okay.
Whenever you're free now, just go for the consultation. Why? Because your one eye power is -6, right? So we need to check with your corneal thickness once. If it's stable, then only we can proceed with LASIK.
Okay.
Okay.
Okay, ma'am.
Consultation will be just for 1.5 hour.
Okay, ma'am.
Okay, done. Thank you. Do let me know if you're interested.
Will know, ma'am. This number is contactable, ma'am?
Yeah, this is my contact number. You can just save. on emails. You can just leave and let me know once, okay?
Okay. Okay, ma'am. Thank you.
Okay, done. Thank you.
So here, what is happening is pretty interesting. That refractive surgery is something that insurance companies don't cover very easily because a person at 22 years has got -2 refractive error. He can go buy an insurance policy at 4,000, 5,000 rupees premium, pays around three premiums, and the fourth premium onwards he can go and go for refractive surgery, which is a loss-making concept. So because of that, insurance companies wanted to filter the people going in, and hence they have put a benchmark. Only 7.5 is covered. Actually, there are policies which covers -2 also, but the premium is going to be higher. So here there are middlemen who has come up, who normally run Instagram ads, attract people. You click on the link, and then they will manipulate the documents, whatever, whichever way. Just now you heard that refractive surgery being billed as a C3R procedure. Three hospitals, the lady has named it very nicely, and even after that, the coverage they will ensure. But the problem is this amounts to fraud. Now, when you look at it as an employee in a corporate company, you're working, you might feel that insurance, health insurance is something that is your entitlement. Understand that health insurance is supposed to be for some unforeseen events, some healthcare needs. A money that you're paying as a premium for the health insurance, if you are not using it, you should be thankful that, okay, I am not using my health insurance. That's a good thing. But utilizing it in this way, it's a very bad thing for business. Now, here another problem that happens is these hospitals are not aware that nowadays the same employee gets a reimbursement for his glasses from Lenskart also through his insurance. So data is always there. It's very easy if you just needs to have a magnifying glass to look into the data and pick up this stuff. And these problems normally for hospitals comes back and bites you after maybe 2 to 3 years when the audit happens. And there are few cases like that. So let us not get into this. I just see there will be a lot of uproar because there are a few hospital names mentioned, but the truth is the truth. There's one agency sitting in Bangalore mentioning your name of the place. If you have an issue with it, please contact me. I can give you the contact number of the person who mentioned it, and you can track it down and take it with them. But this is a genuine call that happened over phone. So I have through 2 3 more such recordings of different agencies, just because I felt that let's explore and find out what they're up to. I was just curious, but when I found out this kind of a thing is happening on a larger scale, and the lady on the other end is blatantly coming out and telling me that, okay, we'll be billing this LASIK as a C3R, then yes, I thought that it should be on public domain. So this is a slightly longer video. Sorry for that, but be aware of such things happening and stay away from these kind of frauds. And as a patient, if you are watching this as a patient, then please, the best things would come to you without marketing. You walk into a hospital genuinely, go to a doctor, speak to them. I don't know any doctor who wants to harm a patient knowingly. Just walk in, don't go through this middleman. This middleman is going to dilute your care, because in the end the hospital will end up getting 20-30% of the entire money that you're paying. So the care also would be similar. So that is there. See, as when you order food from a food delivery app, the cost is higher, and you go to the restaurant, it works out cheaper. Maybe the quantity will be different. So those kind of things are happening in healthcare, and it's very, very sad to notice. So with this, I end this video. Thank you and have a nice day.